Tonight on KGW News, request denied. Why the state says a local birthing center should not have shut down.
I think really this is because Legacy didn't do their homework.
Though Legacy insists they don't have the staff. So what's next? Plus, gun violence taking a disproportionate toll on black men and teens.
What I see out here is a lot of misery, a lot of sorrow.
We look at one local effort to try to stop the shootings long before they begin. Also tonight, leaving the light on. A change of plans for parks after neighbors were told they'd be left in the dark. And later.
Hey, buddy. Yeah. Let's go.
He's technically the equipment manager, though for the Portland Winterhawks, he is so much more.
Just a simple fist bump or a nice chat with Ben or whoever it may be, it lightens up our day.
Because whatever you call this teen, good luck charm and all, he's also an inspiration. Good evening. And first tonight, a local hospital is now under investigation for shutting down its birthing center without state approval. Thanks for joining us. I'm David Mulco. In fact, the state earlier this evening denied the request from Legacy Mount Hood Medical Center. Trouble is the doors are closed and parents-to-be are being diverted. Alma McCarty's back on the story for us again tonight. Alma, what did state health officials tell you about that decision?
Well, David, we've heard loud and clear that many in East County find the birth center at Mount Hood Medical Center to be essential in the community. Now the state's backing up those claims, denying that waiver to close the birth center. OHA said this hospital served more women seeking urgent obstetrical care than any other in the Legacy system.
On Friday, March 17th, Legacy Mount Hood Medical Center effectively closed its family birth center, instead diverting patients for labor and delivery. It's a move many had been rallying to stop.
All of the nurses are here tonight in support, in honor of, and in hope that Legacy will change their mind.
In order to close the birth center, the hospital system needed a waiver from OHA, one they didn't have then and still don't have now, after health leaders Wednesday denied their application. Officials determined Legacy Mount Hood did not meet any of the criteria required to permit the closure, such as maintaining patient services and safety and reflecting community needs.
So those are the things that we were looking for in the waiver approval process.
OHA's Public Health Director Rachel Banks explained the goal now is to bring the hospital back into compliance. She noted this birth center served historically underserved populations, patients with limited English proficiency, with few or no prenatal visits, with limited education, and more patients using the Oregon Health Plan.
Those, are factors that can lead to health inequities as a population, and I think underscores how important those services are.
Meantime, state health officials opened a separate but related investigation into why the hospital closed the birth center before they heard back from OHA.
I think this could have been avoided, and though I acknowledge that Legacy was having difficulty, I think they jumped to the conclusion to close in a way that didn't consult the community, didn't consider the community, and really didn't understand the ramifications of what that means.
State Representative Zach Hudson says OHA's decision is a win after weeks of advocacy and action.
It worked. It made a difference.
Legacy Health responded, writing, "We respect the state's authority in this decision, and we are carefully reviewing the letter provided by the Oregon Health Authority, and that in the meantime, the Mount Hood Family Birth Center will remain on divert status due to the lack of adequate physician staffing to provide safe patient care."
All right, Alma, since Legacy already closed the center and does not seem to be budging, I guess the question is it going to face penalties?
Well, I asked OHA about that. They explained they haven't gotten to that point in the investigation, and that investigation could take several weeks until it's complete. Down the line, if Legacy Health does not reopen the birth center, it could impact their hospital license as well as their ability to get reimbursed by Medicare and Medicaid.
Thanks, Alma. Appreciate the follow-up tonight. Let's get you caught up on tonight's other headlines now, including an inmate who's gone missing from a minimum security federal prison in Sheridan. U.S. Marshals and the FBI are looking for this man, 27-year-old Ricardo Barraza Vizcarra. He was serving an 8-year sentence for possession of meth, heroin, and fentanyl with intent to distribute. Authorities describe him as 5'8" with black hair and brown eyes and about 180 pounds. A Washington County man has been indicted for allegedly sexually assaulting at least 4 people. Police say Ali Mohammed Qureshi may have been meeting victims at a Portland club where he worked as a dancer and dance manager. Qureshi was first accused of sexual assault last May. Police say they found additional victims, and there are likely more who have not come forward. The suspect was indicted last week and arrested on Monday. In the fight against fentanyl, the FDA has approved over-the-counter sale of Narcan nasal spray. Now that reverses the effects of opioid overdoses, and that means Narcan should be available without a prescription in places like supermarkets, convenience stores, gas stations, vending machines, even online by late summer. And it looks like the lights are staying on in Portland parks. The city announced this week it's found funding to replace hundreds of potentially hazardous light poles it says needed to be removed. They are spread out across 12 parks, mostly in southeast Portland. $2 million are now coming from Metro's Parks and Nature Bond, enough, the city says, that all the lamp poles will be replaced. Well, to a follow-up tonight on the latest victims of Portland's gun violence. Last night at 11, we showed you these photos of 2 of the 3 victims in North Portland's triple shooting over the weekend. 17-year-old Eskender Tamra, who was a junior at Franklin High, and 19-year-old Isaac Dowdy, who was a senior at Roosevelt High. Police have identified a 3rd victim, not pictured here, as 20-year-old Patrick Johnson. No word on any arrests. This shooting, just one example that shows how gun violence is disproportionately impacting black men and teens in Portland. The city's Office of Violence Prevention says right now they are in the process of awarding $100,000 to 5 community-based organizations that do street-level outreach programs. Now, Lionel Irving is the director of one of the groups. It's called Love It Stronger. His team reaches out to young people, both those at risk and those doing well, to make sure they have a positive influence in their lives. He says they could do more if they had bigger year-round support.
So it's a whole bunch of different ways that we could attack this, but we need to do it all together and cut all that red tape out of there. All that political games, all that wringing your hands while we write obituaries, we're tired of that.
Well, meanwhile, in response, the program manager for the city says they are working to gain stable funding for these outreach efforts. New at 11, ODOT is looking to make part of McLaughlin Boulevard safer for pedestrians and cyclists. They're focused on a 5-mile stretch from just south of Milwaukee down through Gladstone to the Clackamas River. Right now, they're asking for public input from those who live in the area. Some ideas include adding more sidewalks, improving pedestrian crossings, and adding buffers to the bike lanes. A KGW viewer wrote us concerned this would mean less space for cars, so we asked ODOT about that.
We're not considering taking any travel lanes for any of these improvements at this time.
Okay, they said there may be one exception. They are considering using a right turn lane to help buses move through part of that area a bit faster. You can check out the full plan and give feedback on ODOT's website.